Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to be talking about the way that I measure compliance on a fixed or removable expander. One of the easiest ways to do it. It works a little better with fixed, but before you watch this video, I strongly recommend that you watch the precursor videos, or the videos that come before this in the series. I also have a course that has everything in a logical order. It teaches you from A to Z how to use expanders, removable, fixed, how to design them, different modifications, different variables, everything like that. If you want to access that course, by the way, it's super affordable. It's less than $500 for 13 CE units. It's managed by cezoom.com, but in order to access it, you can just go to my website, Straightsmile Solutions, and there's a link under courses anyways. But I have everything for free as well, because that's part of my mission or core values. If you don't need CE, you can dig around in my YouTube channel, and everything you need that's in the course is there, just without CEs. You just have to dig around and find it. So search by keywords. Make sure you watch a video. I think it has the word Jackscrew in it. Jackscrew, obviously this has the word Jackscrew in it too, but it talks about different Jackscrew sizes and how that can affect your outcome. There's a couple different Jackscrew sizes, that's gonna make a difference. Sometimes you get a say, so you should definitely talk to your lab and make sure they're using the biggest possible Jackscrew that they can. Of course, the bigger Jackscrew you use, the lower, or the more, the less deep it goes into the palate, so the fit isn't as comfortable, and then it's not as good for the tongue position, so it's a bit of a trade-off, which could affect the airway. So you should definitely talk to your lab about it. If you have a super small Jackscrew, then you might even need 2 sets of expanders, which is an additional lab fee and additional time. So these are just variables you have to keep in mind. As well as there's a few other videos you probably want to watch in terms of compliance and how to do turns. So definitely check those out before. This is going to be a more advanced video. And as soon as I finish saying this intro, I'm going to start talking high level. And it's probably not going to make sense to you if you don't watch the other ones first. Okay, high level time. All right, so obviously, these are not the same expanders. This is one that has a posterior bite plate. This is just a traditional Hyrax with lingual extensions that, I have videos about that, so you can see what the difference is and why you use those. But it doesn't matter because the mechanism is the same. Obviously, we're going to be doing turns. So when you first cement a fixed expander, and the same content, the same options are the same for removable expanders too. However, it's not fixed, so there's more variables. So if it wasn't worn frequently or as directed, it still may look like it's turned, but you're not going to get the same outcome. So for that reason, I'm kind of want you guys to learn on a fixed expander, because it just removes the whole compliance variable. The only variable that you have in terms of compliance is then going to be if the turns were done. Now, very commonly, parents will swear up and down, these are the best parents if they did the turns. But a lot of times the turns, they do them backwards. So they think they're doing turns. They're doing turns. They're just doing the wrong direction. Listen, it's super tricky. And like I said, I have tons of videos on how to do turns and what the right direction is. You have to look at the arrow. So you want to make sure you always teach your parents on a dummy model that's not in the patient's mouth first. So you should have a dummy model that's sitting there. You could ask your lab to make a duplicate, and that's your dummy model. It's on a stone like this, and they can practice doing their turns. And then once they get the hang of it on the model, then you're going to have them do it in the patient's mouth. And I actually always want the first turn to be done before the patient goes home, and you're going to supervise that turn and make sure they did it right. The patient should feel a lot of pressure. They're not going to be too happy. Usually I tell patients to take a Motrin first, but at least you kind of know how they're going to feel. And that way the patient is aware of how they feel too. They should know that they're going to feel pressure in their nose probably. They're going to feel something. It's not necessarily going to be discomfort. It's just going to be something, But every patient experiences things differently. So it gives you some idea of how the patient's going to respond in a controlled setting where you're supervising, so that later, the parents can simulate that and duplicate that at home. So when you first deliver it, it's going to be closed. That means you can see these 2 walls here. There's a little rectangle with the 2 circles. It is closed. Now you see up here, the walls are wide. We could almost put a thumb in there, right? From this to this, it's almost an inch. Well, it's probably, it can get that big depending on the size of the Jackscrew, but it's probably more like a centimeter. I don't have any reference point here. The walls are wide, right? There's no walls here. It's super small. It's just right here. Okay. So the excess jack screws are buried under here and they're shooting out here. Here, the excess jack screws are gone because they're all in the middle here. So you can see the difference. As we turn, this is going to widen. So we're going to take something that's only a few millimeters wide here and turn it into 10 to 15 millimeters here. Then you can start counting the screw threads. Right now the screw threads are 0, okay? Each screw thread that you see represents 4 turns, okay? That's just how it works. There's 4 turns in a screw thread. So this is not the best photo here, but you can see screw threads 1, 2, 3, 4, 5, etc., etc. So that tells you about how many turns were done. Once it starts to open up, I'm going to start counting the screw threads and documenting it on my chart, especially if I'm having concerns that things aren't being done. You know, I see 4 screw threads, I see 8 screw threads, I see 12 screw threads. You can count the turns times 4, you know, that's, 48 turns or whatever. And that gives you an idea of approximately how many turns will be done. You want to make sure you're doing that mental math as the patient's coming in. Whatever you said needs to be done. You need to be doing 2 turns a week for 4 weeks, that's 8 turns. That's going to be 2 screw threads, basically. Okay, so did I do the math right? Yes. So approximately, if you're getting 2 screw threads, then you should be obvious from visit to visit. You should start seeing more screw threads. If you're not seeing any difference in the amount of screw threads that are presenting, I mean, obviously, other thing that I'm going to look at is, what are our 3 other reasons we'd stop turning, or what are I have a video about borderline expansion cases, or when to stop expansion. So definitely you want to check out those. 3 major things. Why would we even need to do expansion, right? 3 things that I'm looking at to see if we're done. Number 1, I'm looking to see if the palate is still vaulted. If it's vaulted, maybe it never started vaulted, but usually they are. If the palate is still vaulted, that's a red flag that we need more expansion. Number 2, I'm going to look at eruption lanes. I have a video about that. Watch that. If my eruption lanes are not there, I mean, obviously you're probably going to need to take a progress panel for that, but you can also kind of mentally visualize it, Do I have space for all the teeth that aren't erupted to come down? Or, it's like an occlusogram. We have crowding, obviously in mixed dentition, the nice thing is when you expand and you have crowding, the teeth eventually, because they have freedom to move, it's kind of like if you're at a concert and you're all squished in there. Well, when a couple people leave, you're gonna sit more straight and not sit sideways. The teeth will often straighten up a little bit on their own. They may not be perfect, but once they have freedom to move, they're gonna be less bunched up, right, over time. But and that's the benefit of mixed dentition. But in permanent dentition, you may not see that much alignment improvement without braces or aligners because you waited too much to get that automatic benefit. If you start this when the patient only has a few permanent teeth in, it's pretty impressive what can happen when you do expansion. So, we're looking at eruption lanes. Check out my eruption lanes video, what I look at in a panoramic x-ray to see if I have the right amount of eruption lanes. I always even want to over expand a little bit because you're going to lose 10, 20, 25%. A little less loss in a fixed, especially if you retain them for a few months, than you would in a removable, because removable, if they're not wearing it full time during retention, you're gonna start to collapse. So that's one of the benefits of fixed for sure. So vaulted palates, eruption lanes, and then trying to make sure those upper arch is at least 50% wider than the lower arch. We don't want edge to edge, end to end. We don't want like a buckle or a Brody crossbite. We don't want a posterior crossbite the other direction. We just want it just perfect, just like you did in your occlusion class, just like you did in your denture class. It should look like that, I don't know if we did that in dentures. Sorry. Okay, occlusion class. But it should look like that. So sometimes we have to do more turns on the top than the bottom. Sometimes we do more turns on the bottom than the top if you're doing bottom as well. Sometimes you're not. So you want to try to play with that a little bit. And remember that you're going to have a tiny bit of relapse. So in your mind, keep that into account. If you're doing removable, you're going to have more relapse, most likely, because it's very rare that the patient is super compliant during removable, during the retention period. So I usually like to overestimate a little bit more. Obviously, if I'm going into aligners or braces to finish later, well, if I'm going to aligners, I know I can definitely expand arches a little bit more, especially if I already finished the skeletal expansion. If I got the eruption lanes I needed, if I got rid of the vaulted palate, I got a good tongue position, well, then I'm cool, But if I'm doing braces, I might expand a little bit more because it takes a little bit longer to get that effect in braces, in my opinion. So anyways, this is what you need to know. This is how you measure jackscrews. That way it's not he said, she said. Yes, I definitely did it, Well, here's the proof is in the pudding. I see so many screw threads. Each screw thread times 4 is how many turns you've actually done successfully. And, I just always let them know, yeah, it's really hard. And to be honest, I mean, when I first learned to do expanders, it was no problem because I was like, 25, so I could see things really well. Now, I mean, it sucks when you're, sorry to use that word, but you're in your late 40s or something and you cannot see things as well. I mean, yeah, you can put your reading glasses on, which sounds so old, but I mean, you really cannot see this stuff as well as you used to. And then, you got to have a light and a flashlight. I mean, it's really hard for parents to do it. And I don't think I really appreciated how difficult it was until now I'm the age of these parents that are doing it. So, have patience. It's even sometimes better to teach a sibling to do this than to teach grandma or an older parent to do this. And that's just my suggestion. Somebody that lives in the house that's younger, that is responsible. Obviously we want the parents to supervise it and to say when it needs to be done and to be taking documentation of it. But I've had a lot more success in teaching an older sibling to do this sometimes than an older parent. But just keep that in mind. But yeah, if the parents don't bring their good glasses to the appointment, you're going to need to, you can cement this, but they're going to need to come back for the instruction because there's no point in teaching them something that they're not going to be able to see. So, all right, that was all my tips in terms of compliance. Hopefully that was helpful. Thanks.